This is our scoliosis traction chair. Now, the scoliosis traction chair was developed by Dr. Wogan for the Clear Institute. And this traction chair allows us to provide traction to the scoliosis while derotating and elongating. So it allows us to do some very specific setups that really can't be done in any other piece of equipment. The primary correction here is for an S curve, which is what we're looking at here. Remember, she has a curve going in this direction and then a curve going in this direction. So we're derotating and unbending the thoracic curve. We are derotating and unbending the lumbar curve. We have two counter straps that are controlling that position, so therefore we're only focusing the traction in the areas we want to. And at the same time, we're actually derotating her pelvis by moving her legs off to one side. And this is all happening while we're elongating her and have her on high tone vibration to help relax the ligaments and help travel the traction through the entire musculoskeletal system. Very powerful piece of equipment. We take pre and post x-rays of patients in traction, and we can sometimes get 50, 60, 70% reduction while they're on traction. And many times we're increasing their flexibility of their scoliosis more than they can physically move it. So that gives us a very strong, powerful traction to those areas to help us reduce these curves and get a positive effect in our intensive care. This is a variation of our scoliosis traction chair specifically for a thoracic scoliosis. So the thoracic curve is here in this area. So we're pulling and derotating the thoracic curve. That's the primary use of this setup. We can translate her one way or the other if it's needed, depending on what we see. We're countering in the pelvis and countering up here in the upper thoracic curve to stabilize it. And then we're derotating her pelvis by rotating her legs to the right as opposed to the left that we saw on the other setup. Again, very powerful piece of equipment. It provides a strong derotation and unbending in the thoracic curve, a setup that you can't really get in any other piece of equipment. This is another variation of our scoliosis traction chair, but this one's for a lumbar setup. So you can see the setups are primary for a lumbar curve. We have a lumbar primary pulley that's derotating and unbending the lumbar spine. We're controlling the pelvis and the thoracic spine with the counter strap. We're elongating the spine through traction, and then we're derotating the pelvis by bringing her legs over to one side. This is all happening while she's under vibration. Again, a setup that we can't really get in any other piece of equipment other than this traction chair. This is a modified version of our scoliosis traction chair. This is designed to help reduce a thoracic kyphosis. Now, sometimes patients present themselves with scoliosis and kyphosis where they have an increased thoracic curve. So here we're using the pulley to pull the thoracic spine in the right direction, and then we're countering above and below the pull. This setup can actually be completely reversed. If somebody has a hypothoracic spine and we need to increase their kyphosis, we can pull in the opposite direction, but just by reversing and inverting everything that you're seeing here. Again, this is all done with high tone vibration and elongation and traction at the exact same time.